who is the person who says, yeah, I want to be the research assistant who has to go around and find gum sitting on the ground and scrape it up and keep it?
Do you think it's a choice, or do you think it's some research assistant low in the hierarchy? Like, I have a job for you this week.
Welcome once again to Free Associations from the Boston University School of Public Health, the Public Health and Medical Journal Club podcast for anyone who is as confused by the latest health study as I am by the heat. Nick, it is 120 degrees in here? Yeah, we are doing the podcast version of hot yoga this episode, so I hope everyone is feeling comfortable at home because we are steamed out here. So I am Matt Fox from the Departments of Epidemiology and Global Health from the Boston University School of Public Health, and I am joined once again by Dr. Jessica Liebler from the Department of Environmental Health here at the BU School of Public Health. Welcome, Jess.
Thanks, Matt.
And we have a special guest today, Dr. Collette Ncube, also from the Department of Epidemiology with me here at the BU School of Public Health. Welcome, Collette.
Thank you, Matt.
And as a reminder, head on over to the Population Health Exchange website at www.pophealthex.org. That's BU's hub for lifelong learning. And another reminder, if you can go onto your iTunes or Stitcher or your favorite podcast app and give us a rating, we would greatly appreciate it. And another reminder, so at Population Health Exchange website, if you go to that, registration is open for our Winter Institute. And also, Nick would very much like you to know that tickets are now available for the Health in Focus Film Festival, December 1st through 3rd. And those are open to the public. Those are public health films, several features and a couple of blocks of shorts. So I think that's going to be really exciting. I think you should all rush out and get your tickets for that. And as a reminder, we are once again continuing on our podcast series of episodes related to the strategic research directions. So those are our 5 strategic areas at the BU School of Public Health. So we've got cities and health, climate, the planet and health, infectious diseases, mental health and behavioral health, and health inequities, which we are going to be talking about today. So now on to the show. So today in our first segment, which is our Journal Club segment, we're going to be looking at a study on experiences of racism in New Zealand. And then in the second part of the podcast, which is our deep dive, we'll talk about what it's like working on disparities. And then in our third segment, which is our amazing and amusing, we will get into things that make us laugh out loud or we just want to talk about. Okay, so in segment 1, we are getting into an article that looked at experiences of racism in New Zealand. It was published in The Lancet and entitled Flexible Resources and Experiences of Racism Among Multi-Ethnic Adolescent Population in Aotearoa, New Zealand. I apologize if I have said that incorrectly. An intersectional analysis of health and socioeconomic inequities using survey data by first author Rachel Simon Kumar of the Center for Asian and Ethnic Minority Health Research and Evaluation at the Waipapa Taumata Rao University of Auckland in New Zealand. This one was one that we were interested in, so I don't have any headlines for this, but Jess, can you talk us through what they did? This was a study that included a lot of different exposures and looked at things in a really interesting way. So can you talk us through what they did?
Sure. This was, as Matt was alluding to, this was kind of a beast of a paper in good ways, in many, many good ways, and also in ways that were complex. So this paper takes place broadly in the context of looking at experiences of racism as exposures in relation to health-related endpoints, and specifically looking at intersections of race and ethnicity alongside socioeconomic and income factors and perceived whiteness as a particular exposure as well, and various health endpoints. So just in backing up with a little bit of context, obviously racial or ethnic identity is not experienced monolithically by all people so identified. And the authors discuss how variations specifically in income and wealth, countries of origin, specifically high or low income of origin, for example, experience with migration and immigration status, and perceived whiteness can all play a role in the experience of race and ethnicity for different people. There is some in the research community who claim in many ways that it is income and economics, not race, that drives health disparities seen among people of color, for example, and others who say no, that it is structural racism that's driving economic inequities. And so there is this bi-directional argument in the literature around looking at exposures of race and health in many ways. And what these authors attempted to do was to extract socioeconomic status in some ways through a mediation analysis, to examine the relationship between race, ethnicity, and a series of endpoints, and considering income among other factors as potential mediators. So this paper is focused on adolescence in New Zealand, which is an increasingly diverse country, specifically with a large indigenous Maori population, as well as recent and established immigrant communities from the Pacific Islands, East Asia, the Middle East, Africa, and Europe. New Zealand, and thinking of the history of New Zealand, is a British former colony, as we know, with a mixed history of racial relations, and actually some interesting distinctions between the colonial experience in the United States and in New Zealand, specifically because the white European settlers, who they call Pākehā in New Zealand, signed a series of treaties with the Maori that granted them some semblance of ownership over land and environmental resources, but very quickly kind of backtracked on those agreements, those signed agreements. And there was a tremendous amount of racism in the early years of the kind of forming of New Zealand as a country. There's been dramatic migration to New Zealand in recent years, which these authors highlight. In 2018, more than a quarter of the population was born overseas. New Zealand has a population of about 4.7 million people, and Maori account for approximately 16% of the population. The Pākehā white European descendant population is about 70%, and the remainder are other minority groups. So the authors here specifically are looking at the intersectionality between what they term quote-unquote flexible resources and experiences of racism among youth in New Zealand across multiple identities. So they define flexible resources in two core ways. The first flexible resource is they term structural, which largely relates to wealth and income and being from a high-income country or levels of neighborhood deprivation, these kind of income and socioeconomic status-related factors. And the other flexible resource that they focus on is called embodiment, which they define as perception as white or non-white, kind of your phenotype as it relates to white status. So the authors consider both of these types, these kind of buckets of flexible resources as potential mediators of the relationship between race and ethnicity, and a series of endpoints, including household deprivation, mental health endpoints, experiences of discrimination, and access to healthcare as just an example of the few endpoints they were looking at. And the flexible resources in their conceptual framework could be protective of the connection between racism and some of these negative endpoints, for example, such as high income or white appearing, or can serve as risk factors for and kind of relate to more negative impact. The data that they used in this study came from a study called the Youth 2000 Survey, which was conducted in New Zealand from 2001 to 2019 and involved a representative sample of adolescents in New Zealand, ages 13 to 17, and the students provided self-reported data at school through a computer program. They used generalized linear models to consider the relationship between race, ethnicity, migration status, and various endpoints, and then adjusting for the potential mediating effects of these flexible resources that I talked about earlier. So their respondents included more than 20,000 youth who provided responses to the survey during this study period. And just to note that it was not necessarily the same youth providing the data at multiple time points. At each year, the data was collected cross-sectionally. And their findings indicated that Maori, and who they termed the racialized migrants, so these were migrants who did not identify as perceived white, but were non-white. So the Maori and the racialized migrants from low and middle-income countries experienced the highest level of socioeconomic inequities. And the racialized migrant youth in particular experienced persistent socioeconomic inequalities across 3 generations. And this was one of their interesting findings, that they also, in addition to reporting migration status and immigration status, they also asked about family history and when that child's family migrated to New Zealand. And they were seeing specifically among respondents from the Pacific Islands that there were persistent socioeconomic inequalities viewed across multiple generations. Minorities perceived as white, so those who had that quote-unquote embodiment of white appearance, experienced less discrimination and had more socioeconomic and other advantages than their racialized peers in the terminology of these authors. And interestingly, the embodiment resources, so the perception of being white, mediated but did not fully eliminate the disparities in socioeconomic status and experiences of discrimination or disparities in health. And structural resources, so wealth, mediated these relationships as well, but less strongly. And trend analysis indicated consistently or increasing inequities over time on the basis of these race and ethnicity variables, suggesting, unfortunately, things are not improving over time. So this was my summary of this beast of a really fascinating paper.
Yeah, so when you say, so this was a paper that contained so much data that in some ways it was sort of hard to distill down into a simple message, but I think they did a reasonable job of going through all this information. Collette, I wanted to get your take on this with particular focus on the idea here of these two different types of resources, so structural resources and embodiment resources. Are these terms that are kind of standard, or are these, as far as concepts that they were using in this particular analysis, and how we think about those?
Yeah, thanks, Matt. Actually, I had a similar question.
Okay, good.
The phrasing is not one I'm accustomed to, but certainly I can see the rationale behind their choice. In thinking about the flexible resources being structural, right, I think certainly they could be along a list of more structural determinants. Even the structures, when it comes to, for example, employment, they listed education as one, right? There's certainly other structural resources as well in other domains other than employment or the workforce or education and so on and so forth. And then also coming to embodiment, that was interesting, actually. Their definition, I was not familiar with that as a description, but even in thinking about that and also thinking about their framework for it as a mediator, having embodiment or perception of whiteness as a mediator, it's interesting, right, to think about that as a mediator between race, ethnicity, and whatever the outcomes are.
Sorry, when you say interesting in that it's a different way of thinking about it, or do you have concerns about that from an analytic standpoint? Because I go in both directions.
I have questions. It's more curiosity, I think, from the conceptual, right? And then questions about it analytically. Yeah. Right? So what does it mean for the perception of whiteness to be a mediator? And then I think, which is where I would love to know more about maybe the literature behind this, like the definitions, like what disciplines do they come from, and like being able to read some of that work, I think would be helpful. That would be enlightening, I think. But analytically, then that's where I have maybe concerns / questions.
Yeah. No, I think you're not alone. I mean, and just for anyone in the audience who's not familiar with sort of thinking about mediation, by mediation, we're essentially saying that the exposures that we're talking about here have effects on outcomes mediated through these pathways that we can try to understand from a statistical standpoint. So say more about what your concerns are, and I'll see if we share them.
If we align,
yes.
So,
or we have different ones.
Yeah. So just an initial one is that just thinking about so the racial and ethnic categories that they identify here, in what way would they determine the perception of whiteness? Right? It's almost like there's the perception of whiteness, there's the race ethnicity.
Yep.
Right? Is there really this ordering? Right? Becomes the question. Does one affect or determine the other? Is more the question that I have conceptually and analytically. I don't know, what was your...
Yeah, no, it's exactly the same thing. I mean, some of these, I actually have questions of could they actually be a mediator? So they have a DAG, a causal diagram. It's a very simple one, I think, just meant to really illustrate mediation because they don't include the confounding pathways, which I would have liked to seen. But okay, fine. They're being clear in what they're trying to do. So in the pathway between ethnicity and these, economic and health and interpersonal outcomes, they have deprivation, migrant generation, income level of country of origin, and perceived ethnicity. Okay, so I can understand some of them. Income level of country of origin, that's not probably really a mediator, but it's a proxy for income. So there could be a mediating pathway, but it's probably not that simple, right? It's probably a confounding pathway as well. I mean, you'd have to be more detailed in how you got from something like income to ethnicity, but I suspect there are common causes that would get you there. Migrant generation, though, I mean, that seems to be a case where you're not actually looking at something as a proxy. You actually care about migrant generation. How does ethnicity affect migrant generation? To me, that sounds like more like a moderator, that the effects of ethnicity would be different depending on the generation. Let me be clear. There are aspects of this paper I have sort of analytic quibbles with. Overall, I generally think the results fit with what I would expect. That doesn't make them right, but they do fit with what I expect. My concerns are really just sort of about getting the ordering right they're not really with the overall result. But yeah, what's your reaction to that?
My reaction, yes. I mean, there's, as I alluded to earlier, it's more the conceptual, the theory aspect of it that's informing the work. And then there are the questions about the analytics. And I think I'm not as clear on the alignment of the two, but certainly I think reading some of the work that obviously has shaped the perspectives and the interests of these authors would be helpful, right? So knowing more about that literature would influence, certainly if I already had heard of the words, right, the structural and embodiment, structural resources terminology, then that wouldn't be a question. So I think I have that additional learning process to do and just understanding that. And then going on to the modeling to then figure out, okay, so in what situation would this really not be a mediator?
Yeah.
And I think then I would feel more able to constructively make suggestions regarding an analytic approach that maybe does not include the ones that they have in there.
Absolutely. It is worth noting, they do actually say at one point in the paper, our mediation analysis use a deliberately simple exploratory approach to establish proof of concept. And to me, that's I don't completely think that's a free pass because the paper is largely designed to assess mediation. So to sort of say it's sort of proof of concept strikes me as, I don't think I can totally give them a pass. On the other hand, I think to me, it's fine to say we're trying to establish something. We would need more detail, but they do then say our findings offer broad directions for policy and program interventions. So if you're saying that, you are saying it's a little bit more than proof of concept. But okay, that's probably a level of detail we don't need to get into. Jess, what was your reaction to this?
Well, there's many ways in, where I really like this paper. It was very creative in terms of their thought process and in terms of just the sheer number of variables that they included in these different analyses and models. I mean, in looking at the manuscript, there's pages and pages of tables. There's tables that don't fit on a single page. And so it's spilling over both the descriptive tables and then also the tables with the, adjusted coefficients. I think
beautifully colored tables.
Beautifully colored in the heat map kind of format. And actually, the heat map format makes it easier to look at all the data visually because they present in red it's odds ratios, right, that are in excess. That's where they're saying they're increased, elevated compared to the Pakeha white baseline.
Yep.
And so that makes it easier to look at. But as a reader, my challenge of this paper, because I read them really closely to provide these summaries for the podcast, it was very difficult for me to distill what were their core exposures, what were the mediating factors, what were the confounders that they considered, if any, what were the endpoints. And it seemed that at times some of the variables doubled as exposures and endpoints depending on the analysis that they were looking at.
Yeah.
And it was just confusing.
Yeah.
That was my challenge. I loved it in so many ways because it was especially the aspect of perceived whiteness that I think is not as commonly included in these models. I don't exactly know how it was asked of the adolescents in this study, but it was standardized clearly across all the multiple years. And so I think just in reading it, I found it a little confusing, but it was a very, very interesting paper nonetheless.
No, and I agree. I mean, so we've got a paper that overall shows a relationship between some aspects of ethnicity and health and economic outcomes. Some of them were not as clear. So they say, we do not show a clear association between symptoms of depression and perceived whiteness, but they do find strong effects of migration generation having an effect on these outcomes, and second generation migrant youth, particularly Pacifica, are as vulnerable as first generation migrants. So, a lot of things that they looked at, some of which they found, I don't know if we want to say effects or associations. I think probably we want to say associations. Some of which they didn't, and it's very broad, and I think that's probably quite commendable. But, at the same time, it isn't clear to me, and one of the things I wanted to ask you both is this a causal paper or is this a descriptive paper? And would we ever want it to be a causal paper? So leaving aside the mediation, which clearly is trying to get at mediating effects, but the sort of main analyses, are these descriptive, in which case we wouldn't want to adjust for all kinds of potential confounding factors, or is it causal, in which case we do, and then I need sort of a little bit more detail? Did you all have thoughts on, by the way, we can answer this question specifically about this paper, or we can speak more generally. I mean, when we're when we're looking at relationships between fundamental causes of health, do we want to adjust for things that are different between those populations if we think that, essentially those are part of the reasons why they're different? And now I suppose if they're confounding, we do, but if they're mediating pathways, we don't. So I'm just curious how you think about it.
This is a hard question. Colette and I are eyeing each other to figure out who's going to go first.
Good. See, I asked the questions so I don't have to answer them.
So these authors present both, right? They present both a descriptive analysis of the prevalence of these different endpoints by the different groups. That's one of their early page-long tables. And then they also move into this adjusted regression framework where they're trying to get more towards a causal understanding. Where this paper, I think, is really valuable and where research in this domain can be really valuable is trying to unpack, obviously, the impacts of racism on health and to try to disentangle the effect of income and also wealth. I think there were, a number of the variables, specifically country of origin. I was thinking more along the lines as a proxy for wealth as compared to income, kind of family wealth and historical wealth and just kind of resource in the family, not so much how much you're making or your parents are making right at that moment in time. And I thought they were taking steps in that direction towards a causal understanding. And I think it's important in this kind of domain to understand, are we really just looking at perceptions? Is the association between whiteness and, or racism and poor health, is that really driven by perceptions of whiteness in terms of phenotype? Is it driven by what people experience on a day-to-day basis as they walk around in the world? Or is it in part driven by the history of racism that relates to wealth and relates to kind of, educational opportunities and relates to your history bringing you to that moment, or some combination of those two? And I think thinking about both of those factors is a really great place and kind of brilliant place to start in thinking about these causal relationships involving race. So I think primarily this was a descriptive paper, but I think they were taking steps to make those causal observations that I think are important and valuable.
Yeah, and I agree with that. Part of where I step back from things is I say, okay, we're dealing with cross-sectional data. So immediately I start to wonder how much causal inference can you actually do? We have proxy variables, right? They're not actually measuring the things you'd probably want to measure. There looks to be limited ability to completely control confounding if you're in a causal context. And yet at the same time, I don't know. I'm not totally sure it matters in the end because I think, sure, it's cross-sectional, but it's hard to come up with a particular mechanism. We know the exposures came before the outcomes. You'd have to come up with a mechanism, selection bias, to explain that away. The variables are proxies, so they're potentially mismeasured, but I can't come up with a way that it would be, well, I suppose it could be differential misclassification, but on average, it's probably more non-differential. So any effects, on average, with some caveats, are probably attenuated. So I don't know. Part of me wonders is I have a lot of concerns, and maybe those concerns really aren't founded. I don't know. Do you have this similar, different reactions?
Yeah, to answer your question, your phrase, I interpret this as a descriptive study, and I think it's valuable as one. I think
I would agree.
It doesn't take anything away from it being, by describing it as a descriptive study. And I think it's a very interesting topic. I think it's great to see this work done in different contexts as well. Obviously, being located in the U.S., I tend to see more studies in the U.S. context. So to see this in different contexts, I think is a value in and of itself. Now, if it were to move on to a more causal, I think first the question would need to be stated as causal, which I don't interpret this work to have been presented as a causal question particularly. But then if we, crafted one, right, developed a causal question regarding, what causes, so what's the question? Right, then. so
this is where I was going in our next segment. Like what? So maybe we can sort of transition because this is fairly open-ended.
Sure.
We want to talk with you about, disparities research in general. So I want to go there. So maybe I could sort of ask the bigger picture question first, which is, can you just start off by telling us a little bit about your work in disparities, and then we can kind of jump in with some specific questions that relate to what you just asked, because I have so many questions.
Sure, we can do that.
Yeah. So tell us about your work.
Yeah, so I'm a social and perinatal epidemiologist, and I primarily study the role of social and structural determinants in racial and ethnic disparities in perinatal outcomes.
Yeah.
So using various methodology, obviously our epi methods, and more recently some of our system science methodology as well, to really get at how we would measure some of these things, for example, structural racism, and just thinking creatively about those kind of things. And so, yeah, that's what I do.
Fantastic. And so then to go back to connect it to what we were just talking about, and you asked the question, but I think I would turn it back to you more just not specifically about this, but more broadly, when you think about studying disparities, I mean, we have so much research documenting disparities, and yet we continue to document disparities over time. In COVID, we were back in the position of having to first document the disparities before it was, able to, before people were ready to jump in and try to figure out what to do about it. So when you think about studying disparities, what would you say makes for a good question? I mean, do we think descriptively? Do we think causally? Do we think about mediation? How do you go about that process, and what do you think makes for a good question when it comes to disparities work?
Well, I would say all of the above. I think they're all interesting to me. They're all interesting where, like you described with COVID, we have to start somewhere, right?
Yeah.
As part of the process. In some work, even when we've been doing it for a while, there's a new question where we're interested in a description of a relationship that we haven't reported on yet. So certainly I think all would be valuable. For me personally, I think in this space, what would be nice to see as a next step in either the work that these researchers do or in mine is to think more about those mediators, right? So, and also to analytically think about the complexities there. So at least in the work that I've been thinking about and working on, and others in at least the US context have been publishing work on, and I'd assume in other spaces because obviously I haven't read in all spaces, right?
Sure.
But it's to think about those mediators. What's the relationship between some of these mediators, some of which they mentioned in this paper, and the exposure, right? So even thinking about that relationship between the perception of whiteness and ethnicity, right? I'd assume some level of interaction there, right? With regards to how it would affect the outcome. We can think of even, say, maybe employment, right? Opportunities, right? Certainly influenced by one's race, ethnicity, but would assume potentially some complex relationships there, right? And how those variables are related to each other. Once you put in the generational aspect and start thinking generationally, right, some of these opportunities are different across generations, and what there might need to be more complex modeling to factor in the generational piece. So, for example, I'm thinking about some work that's been done in perinatal epi, looking at health outcomes of individuals depending on how long they've been in a country. So not necessarily, well, and I guess in some respects, generational, but just thinking about the length of time, right, individuals have been in the country and how their outcomes or their risk of having certain outcomes differ depending on the length of time, right? So what we've typically seen, at least in the context of the US and Canadian studies, is that if individuals have arrived more recently, their health outcomes tend to be better than their race-similar counterparts, right, in that particular context. And the longer they've been there, the worse their outcomes tend to be, right? And so there's that element of time. And I guess the point just being made is that I think to get at more causal questions in this space, the methods just get really complicated.
Very complicated.
And they just can't be they tend not to be very simple analytic models to get at that. And I think they shouldn't be because it's a very complex topic.
Yeah. So let me probe that a little further, because we're spending a lot of time talking about mediation here. And just to make it explicit, presumably, in my understanding, the reason we care about mediation in this case is because here's a space where you can identify disparities, but in order to change the disparities, we need to understand the mechanisms by which you go from whiteness to some health benefit or deficit, depending on what you find, to understanding the mechanism, because that's where we actually want to intervene.
Correct.
So that makes a lot of sense to me. It becomes, as you say, very complicated because let's just be honest, when it comes to observational epidemiology, we do struggle to get at total effects. So what is the effect of, red meat consumption on heart attacks, right? We have a hard enough time figuring that out, let alone in this case, figuring out the mediating pathways, because now you have to deal with not just confounders of the total effect, but confounders of the mediating effects. You got to have the timing measures right. So many challenges. But leaving that aside, I do wonder, so you talked about, generational effects, but generation is not something we can intervene on. So how do we think about things like that, which are clearly important? We can very clearly identify differences in populations, and yet that's not something we could change. So do you have to approach those in a different way? How do we think about those?
Yeah, no, certainly we can't intervene on those in any reasonable period of time, right? In any ways that we'd be interested in doing.
Well, can we, to clarify, can we intervene on it at all? I mean, somebody's generation doesn't change, does it?
No, the generation of time, the amount of time that they've been in.
I see.
You see what I'm saying? Because it's like,
I'm in the country,
am I first generation, second generation immigrant, third generation,
Got it. Yep.
No. So we wouldn't, right, necessarily have an intervention designed to address that. Yep. But I think analytically we would, like, if that's the time horizon we're interested in, we would need to account for that in some way, assuming that's, right, also under the scope of our research question.
Right.
But we would need to account for that. And then the question is like, well, how? And in what way do we think that operates, right? Because certainly we see differences in general in populations that would otherwise be classified as of the same race, depending on the generation, right? As far as like generation, the first, second, third generation, and so on, we see differences there, which likely means their experiences are different. And to your other point earlier, that we're interested in the mediating factors because that's what we can intervene on. The primary basis for that is that we have already then agreed that the differences observed between the racial and ethnic groups are not biological differences. Sure. Therefore, we wouldn't be concerned other than on the mechanisms. We're concerned about the mechanisms because really that's what's resulting in the disparities that we're observing.
Yep.
So I think that's lead to your question.
Yeah, no, that's exactly what I'm getting at. I think it's one of those areas that is both extremely important from a public health standpoint that we understand, but also from a method standpoint is really, an interesting area and where we come into a lot of interesting discussions and challenges of how we get this right. Because I think you could argue we don't need the exact right number. We need a number that tells us whether or not a policy intervention is likely to be beneficial. Ideally, we'd like to have the exact number, but we never get the exact number with anything, right? But we have to get the methods right in order to be able to get the right answer.
Right. Yeah. And even with the methods, it's, something I've been thinking about is even when it comes to mediation analyses, it's like, well, what kind of mediation analysis are we doing? So certainly, of course, we need to think about the things that you've talked about being the confounders, right? And particularly if these are time varying mediators, like things get really complicated. Now it gets even more complex. Yes. Yep. Which maybe I'll come back to that point. But we have to think about all those things, like, the confounders, but then also even just the assumptions, right? Like, okay, so if we're saying, I think, which is not uncommonly done in mediation analyses, which it would be for one group to essentially assume a comparable distribution of that mediator relative to, like, whatever the reference group is, which tends to be the majority group. In that particular context in the U.S., white populations, and similarly, it seems, in this New Zealand study that we're talking about. But then it's, the thought experiment then is what kind of intervention would accomplish those kind of things, right? Looking at data in the U.S. with income disparities, which is typically the data we have. We don't tend to have wealth data in public health studies or population. So we go with income. They're quite wide. The disparities in income are quite wide, right? And so to essentially then have the distribution of income be comparable between Black and white individuals, I mean, what scale of intervention are we really talking about? And so is it really just an academic exercise as well? Like we would need this. Yeah. So I think that's a question we need to ask. Because we don't think we could ever convince anyone to
that could be intervened
to do this as a policy intervention, say.
Right.
Okay.
Right. But it's something to think about. I think it's not to limit, I think, the models that we run or that kind of thing. But I think it's just something to think about, right? Because if that's what we're modeling, how we're modeling the mediator, that's what we're saying, right? We're saying there's an intervention that would accomplish this change in the mediator distribution. And therefore, if that was accomplished, this is the narrowing of the disparity that we would observe.
And so just to make that concrete, so to go back to the paper we were looking at, if we're saying that there are observed differences in ethnicity in terms of a health outcome, and we think that one of the mechanisms is income, then if we could change the income distribution of the populations to be equal, what percentage of the health disparity would go away?
Right.
Yeah, to me, that's a super interesting question, hard one to answer.
Yeah. Yeah, and, I think part of it is making those explicit, because I don't know that we always make those explicit. We just model it and we report it, but we don't say what we're actually explicitly assuming here.
I have a different kind of question
Please.
for you, if that's okay. So I'm an environmental epidemiologist. We think a lot about exposures, and there's been so much conversation in my department lately, and I'm sure especially our student listeners are interested in, when you think about racism in the context of your research, how do you define that in terms of variables? What variables do you use to define experiences of racism? I think there are, we were talking a few episodes ago with John Jay, who was talking about redlining, for example, as an example in the U.S. of a form of structural racism. We've talked about measures of deprivation, of economic deprivation in the context of residential segregation specifically. And then there's these individual level experiences of whiteness or racialization. Mm-hmm. And I was interested in your work, how you characterize racism. What are the variables that you use? How do you, quote unquote, measure it as a part of a research question?
Yeah, great question. Well, difficult.
We don't know the answers, so we're asking you.
Right. So I at least think about them just in the same way that you're thinking about them, and considering going forward, what would I do? What have I done? What could we do better, as many of us in this area are thinking about? And certainly, racial residential segregation has been a measure of structural racism that has a long history, right? And I would say, there's certainly other neighborhood, as we call it, neighborhood level metrics, including, so there's the income inequality, so on and so forth, social cohesion that has ties to, racism or racialized experiences. And so some are explicitly clear, I suppose. Like you might think of racial residential segregation, that's clearly looking at differences in where individuals are living on the basis of race. But the assumption there is that that's influenced by policies, right? Mm. The policies are shaping where people can and cannot live, right? A part of where people live is by choice, but a large part, at least in the U.S., is not only by choice, right? So there's certain influences there. And I think also those same or other policies and decisions that are made also determine the dynamics of the neighborhoods, right? Are they cohesive? Are they not? What resources are available? Is there investment? Is there disinvestment in areas? What decisions are made about what resources enter or exit the neighborhoods on the basis of the composition of the neighborhood, mm-hmm. right? So not all of them are explicitly race. They don't all on the face of it appear to be specifically targeting race. But then when you start to think about them and how these decisions are made, you realize that there is that component, that underlying characteristic of them. And certainly decisions are made on the basis of individuals and where they live and who the populations are that benefit. And I think part of it gets complicated when you think over time, right? Because there's this, and this is something I think about a lot methodologically. It's complicated. And
really
so
complicated.
Still to be determined about how this might look in some of my modeling work is, the area. So this is just limiting the discussion to neighborhoods or where we live after you've determined what constitutes a neighborhood. Another discussion. But even in that, it's like neighborhoods change, right, over time. And so, I talked about investment and disinvestment, but even when we think about what that experience looks like at the neighborhood level today, that experience is different potentially 5 years from now, right? Either because the neighborhood has changed, mm-hmm. right? Mm-hmm. Assuming I still live there, or I have moved and my neighborhood experience has changed because of where I moved. But all neighborhoods change in some way, right? And so how do we characterize the experience of, in this case, structural racism when there's this element of dynamic? There's change, there's dynamics, and decisions are made to influence the change and in response to the change that's observed in the neighborhood. So I haven't done much work to answer your question about interpersonal racism. Personally, I've focused largely on social and structural determinants, including structural racism. And so that's mostly what I could speak to. But certainly I think it would encompass not only the characteristics of the residential area, but also then more the policies, the decisions. And really when we're thinking about structural racism, a part that I think is left out is how each of the social sectors that we interact with, one of them being residents, but also then being the workforce, right, being education, so on and so forth, how all of those are interrelated. Do we study how they're interrelated? Do we study how they respond to each other, right? And then also do we study how they shape our beliefs, our values? Because that's part of the definition of structural racism, right, is that it's all of those, this discrimination in each of those sectors and how they shape beliefs, values, and also the distribution of resources. That's part of the definition, but...
That's fascinating. Thank you so much. I was going to ask you one additional question, which I was thinking of as, thinking about your perinatal research too. Do you think about racism as an epigenetic exposure or as the consequence of epigenetic change? I mean, it's interesting to think about.
Can you define that just
sure,
for those who are...
Sure. No, I'm thinking about environmental factors that change our DNA and thinking about, especially in the context of perinatal research where you have moms and you have babies in utero. And, to the extent that the mom's experience in the world affects the child's life while the child is in utero, and that those, that social experience of racism then can program the child to have a different set of experiences than if the mother had not had, potentially those social experiences. And I was interested in your thoughts on that in terms of if there is any evidence that you're aware of that looks at, kind of racism as an epigenetic factor.
Yeah, that's a great question. So actually, interestingly, a couple of years back, I was doing some looking into epigenetics, so to speak, right? Primarily, it was shaped by my interest in this generational transmission of risk for poor birth outcomes, looking to understand that. But certainly, there's, at least I'm aware of one paper that I found at the time that was looking at essentially this in the area of structural racism. I wouldn't say necessarily that there was structural racism per se, and epigenetic responses. To your question, do I believe that structural racism essentially can result in epigenetic changes that would have relevance for perinatal health outcomes? A very good question.
I don't know the answer.
Does that mean you're non-committal on the answer?
No, I think I've thought about it, and I think it's possible. Thing is, I haven't done work in it, and because it's been a couple years since I looked it up, I don't know what has been written on it, since then. So obviously, I don't want to speak, I don't want to speak incorrectly about people that are currently doing work there. But certainly, at least there's this thought, and I'm not sure who is writing on this exactly, but that essentially the thought process is that we would respond in ways biologically to support. Obviously, longevity of the race, the species, and so on. So they might be responses to the environment that we're in that could result in influencing, the timing of delivery, for example. And so I think it's reasonable to assume that could be, but I can't say that I can speak to.
No, thank you. It's very interesting. It's something new. It's something that I was just thinking of in hearing you speak and knowing your research on, in perinatal and reproductive spheres. There's certainly evidence that intensified stress can cause epigenetic change. And you wonder about kind of large structural experiences with discrimination and inequity. And we've talked on the podcast too about how birth outcomes specifically can set up, are particularly relevant because they can have all of these lifetime consequences. And so the mom's experience is particularly important. So thank you for sharing. It's very interesting to think about.
It's a great question. Wish I had a better answer.
We invite people on to give us their best understanding. We understand not everyone knows the answer to all the questions. We don't know very much. That's right. Exactly. All right. Well, that was absolutely fascinating. We do need to move on to our last segment, which is our amazing and amusing. And Jess and I both have something, I believe. Jess, what do you got for us?
Sure. I have two articles thematically associated with research, perinatal research and research on children that caught my eye in the last week, in part because they're a little bit funny as a parent to hear some of the headlines. But this is an article that was published a couple of days ago in the journal Current Biology. Okay. And the headline, the title is A Method to Soothe and Promote Sleep in Crying Infants Utilizing the Transport Response. And so the transport response is basically carrying the baby.
Putting your kid in the car?
Carrying the baby in your arms.
Okay. I feel like cars are better.
This is kind of, and so the highlights, the kind of key points highlights, infant cry is attenuated by transport, but not by motionless holding, which means that infant cry is attenuated by transport, but not by motionless holding.
So you have to be moving.
If you're just sitting still, the infant cry is not going to be attenuated. They're going to continue to scream if you don't move. But then if you move, the baby might try to stop crying, or the baby might start to stop crying. And so what these researchers did, which I love, is they ran a series of experiments with crying babies to try to see what combination of activities is most likely to make the baby fall asleep. And so they ended up, they said, if you hold the baby still for 5 minutes, if you stand up for 5 minutes, if you kind of walk with them in a jostling way for a few minutes and then lay them down and walk away.
I wish we had video here. You could see you pretending to rock a baby.
I think about this because I have an almost 3-year-old, and he's been screaming a lot lately, and so this is why this caught my eye. So what they figured out after all of these series of experiments, the best approach to soothe a calming baby is 5 minutes of transport, quote-unquote transport, which means holding the baby, okay? And then lay that baby down after 5 minutes for 5 to 8 minutes before walking away. And this was what they determined to be the best.
Laid it down on the ground or on the
in a cot. They have a series of receptacles for the baby. One like a bouncer chair or like a little baby, like a little bed. And so they had all these combinations of walking, holding, laying the baby in a cot, laying the baby on a bouncy chair, and then sitting still. And so they determined 5 minutes of walking, followed by 5 to 8 minutes of laying the baby down gently before the mother walks away, was the optimal way to make a baby stop crying. And so this is one of these things that as parents, like you're just doing on trial and error, you're like, maybe if I bounce the baby a little bit, or if I walk back and forth, or if I rock the baby, or if I kind of burp the baby, you're trying all these things. And so this is actually something that people did.
Okay, but wait a minute. So all three of us in the room had or have small kids.
Yes.
We need to ground truth this? Is this accurate to your experiences?
Too. Like you're like 5 minutes, gotta put you down. Now.
I mean, I would personally say, assuming I understood the experiment protocol correctly.
Did these babies sign consent?
Well, that's another question. But certainly I think the 5 to 8 minutes wherein you're standing next to said cot, where the baby can, I assume, see you.
Right. Or you're kind of like touching the baby.
Would not work for my would have not worked for my children.
Because they...
If I'm present.
They want you to be holding them. Right,
if you're there, what's your purpose?
Right. What is your purpose? Why are you not holding me? Why am I in this little chair?
My kids still work. They're in college. What is your purpose? Yeah, okay. Fair enough.
Would it have worked for you?
I don't know the answer to that because it's been a long time since I had little ones. But I think it might have worked. I don't know. I feel like there was never one answer. Like you'd figure something out that worked and then it would stop working a week later.
Because the baby was kind of onto you, right? You're like, that's always with my kids where they're like,
smart.
you think 5 minutes is going to, maybe it worked once, but doesn't mean it's going to work tonight.
Yep.
Mom, I think you're really going to be really loud. Right. And this was paired with a second article that I saw about nap transitions, which I thought was pretty interesting too, because my little guy is just at that process of transitioning out of needing a nap, but he's not quite there yet. And so there is the sense that like nap transition, when do kids stop napping altogether? And, for parents, it typically causes about a year of stress as your kid is like kind of transitioning, but like kind of still needs to nap and kind of doesn't need to nap and doesn't want to nap. And you're fighting with them for about a year. That's been my experience. And so what this other paper showed was they were looking at brain development and development of the hippocampus, that dropping that final nap was associated with some more elevated state in hippocampal development, meaning that it was
tied. Dropping the nap caused
the
other way around.
The development, and then you stop.
You have
napping.
the development, and then you stop napping. And so the idea that there should be like a structured time of like in a certain preschool, kids don't nap after age 4 or whatever it is. That it was very individual and kind of tied to brain development, which I thought was interesting too.
So does it go in the reverse direction? Like is my hippocampus shrinking because I want to nap all the time now?
These authors were saying that napping in young kids is very tied to memory specifically, but memory and learning. And so kids who drop the nap and still need to nap, it affects their memory and learning in those early ages. So those are my two kind of early childhood pieces from the last couple of weeks. But I loved the transport response in particular, the maternal transport response.
I still think we need to check out the effect of putting the kid in the car, because that to me was always the most effective.
Fail safe.
All right. So I have a short one from Scientific Reports, Nature Research, which is an article entitled "The Wasted Chewing Gum Bacteriome."
Mm-hmm.
So this is a study in which you can guess from the title, they went out and found gum that had been...
Oh, they found it? They didn't just collect it from people. They scraped it off the ground.
Scraped off the ground. In fact, they also did experiments where they chewed it and then left it out, because they specifically wanted to know how long does the bacteria from your mouth and your DNA get into the gum and then last there on the ground. So could you do forensic analysis on it, after it had been sitting on the concrete 2 weeks later? I barely understood what they actually, found in terms of, but basically, much of this lasts quite a while. And so if you are spitting your gum out onto the ground, you are essentially leaving a trace of your biome. And this would be a potential source for studies, but also, DNA analysis, forensic stuff. A lot of interesting facts in here, though, which I didn't know. So the first modern chewing gum was introduced to the market in the 19th century. And it's estimated that Iran and Saudi Arabia are the countries with the highest chewing gum consumption, where 80% of the population are regular chewing gum consumers. And the value of the chewing gum trade is estimated more than $30 billion in 2019. So lots of really...
Wow, that's a lot of gum.
It's a big market, but the point is, I read a study like that, and then my immediate thought is, who is the person who says, yeah, I want to be the research assistant who has to go around and find gum sitting on the ground and scrape it up and keep it?
Do you think it's a choice, or do you think it's some research assistant low in the hierarchy? Like, I have a job for you this week. You're going to go scrape some gum.
That's a really good question. I do not know the answer to that. And I'm not gonna go into details. But I know of a study that was conducted in, I'm going to say, is roughly the 90s, in which what the research assistants had to do was, when I heard this, I thought, I am so glad that all I ever did was data analysis and data collection and not sample collection. I just think you got to have a good constitution to be able to do these things. I could do it. I couldn't.
Well, I wonder as well. So with the gum collection, how would they separate bacteria from other sources? Right. So you apply
pigeons? What are we thinking?
Fair enough.
That's
I hadn't
true.
thought about pigeons. I hadn't thought about pigeons.
Would come over to it.
But certainly you could adhere the gum to a trash can.
Yeah, I mean, I don't know the answer to that, but I think I have to believe. So what they talked about, the components of gum and how what ends up on the surface would be very different from what ends up in the middle of the gum. And so I think that's sort of how you can figure it out. And they were saying, in some ways, you've got this medium that is designed to encapsulate these bacteria, but whether or not they survive is a different question. But they kind of get pushed it. I don't know, masticated. I don't like that word, but chewed up and
well, it's almost like some sort of core sample where it's less likely, right?
Borrowing. They talked about that too, like layers over time and how deep it in and I'm not doing that job. Just saying, I'm not doing that job. All right. Well, we have reached the end of our program. If you got any feedback on this or any other episode, or you want to suggest a study or a topic for us to take on, you could tweet us at @PopHealthEX. Or you can tweet me at Prof. Matt Fox, or anyone else. Do you have a Twitter yet?
I do. It's just at Jessica Liebler. I just don't remember the password, but it's there. I know. I know.
Collette, are you on the Twitters?
I'm on the Twitters. My Twitter handle is at Collette Ncube.
There you go. And you can also find us on the Population Health Exchange website at www.pophealthex.org. We want to thank Leslie Talali, an Assistant Dean of Lifelong Learning at the BU School of Public Health, for supporting the podcast, Nick Guler for sound editing and heat control, and Mark Takakchi for editing, helping Nick with the editing. We especially want to thank our guest Dr. Collette Ncube for joining us on the podcast. Thanks for being here.
Thank you,
Thanks for
Collette.
having me.
And we hope you will download our next episode.